So I've used IRD, ixazomib, lenalidomide, and dexamethasone pretty frequently. I think partially because of its convenience. Again, I work at probably the hardest institution to drive to in the country, and patients do live far away, and so drugs administered in the cancer center are challenging. I've had reasonable success with triplet therapy. I think particularly to keep people in remission when they did well with bortezomib, lenalidomide, and dexamethasone. There are patient tolerability differences, so some patients really do get some GI side effects from the ixazomib, and that seems to be dose dependent. So in my own experience, it seems like many patients don't tolerate the full 4 milligram dose, and I have to lower it to 3 or even 2.3 milligrams. The drug has a long half-life, over a week, and so it tends to build up over time. So patients will typically tell you if they're having fatigue or GI side effects from the drug that the third week is harder than the first week, and that's how you can pinpoint that it's the ixazomib causing the problem, and then can just dose adjust. I think for some patients, convenience is important, and so having an all-oral regimen allows patients to continue on with their life and not be kind of stuck going to cancer centers for treatment, either infusions or shots somewhat indefinitely. I think that since it's a pill, it's a little more easy to just continue the regimen that worked for them as part of their initial therapy. So I think it may be a way of keeping people's disease controlled for longer right from the very beginning. I think also the drug can be given closer to its more maximal dose, or can be given at its maximal dose because patients are willing to take a pill. And often the drugs, the kind of similar drugs, similar proteasome inhibitors are used at their more maximal dose at the beginning and then get tapered down with time because of patient preference. And that's where ixazomib, I think, has a good role. I think, to be truthful, a carfilzomib, if somebody is sick, tends to work more quickly and aggressively for patients that you need a quick response. So I would tend to use that drug in those types of patients. But ixazomib has the advantage of the convenience.